This is an evolving situation that is changing day by day, even hour by hour. It began with an outbreak in the Northern Beaches area of Sydney after a long period of no community transmission. This led to Western Australia reclassifying New South Wales initially as low risk and then later to medium risk. This effectively meant we once again put up a hard border with New South Wales. Today, Victoria and South Australia have taken the same action which Western Australia took on the 19th of December. They have also closed their borders to New South Wales. We took that decisive action early to protect Western Australia because of the unpredictable situation in New South Wales. Since then, the tentacles of that original outbreak in Sydney have been spreading slowly but surely. We have been watching with great caution, ready to act if necessary. What has happened since Christmas is the original Avalon cluster has now spread to other suburbs in Greater Sydney. And yesterday, we saw those enormous queues of people waiting to be tested south of Sydney in Wollongong. Then, what we feared happened occurred. It would appear the virus has jumped the border into Victoria. Late yesterday, there were 3 confirmed cases of COVID-19 near Melbourne, after the state had gone 2 months without community transmission. Those cases have possible links to the Sydney outbreaks. Today, a further 5 cases have been confirmed. That brings the total of live community cases in Victoria to 8. So clearly, we are dealing with an unpredictable situation which is likely to get worse before it gets better. This morning, the nation's chief health officers, the AHPPC, met to discuss the situation on the East Coast. We then had a meeting of our emergency team to discuss the health advice. There were several outcomes from that meeting, which I will now detail. Victoria and South Australia have today taken the same action which Western Australia took on the 19th of December. They are closing their borders to New South Wales. In light of the outbreak in Victoria, Western Australia will strengthen its border controls to reduce the risk of the virus coming into our community. Based on the latest health advice and the evolving situation, Victoria will now transition from a very low-risk state to a medium-risk state under our controlled interstate border arrangements. Effective from 12:01 a.m. tonight, travel from Victoria will no longer be permitted unless you are an exempt traveller. The list of exemptions will be the same as New South Wales. But we also realise this will cause some inconvenience to Western Australians who have gone to Victoria for Christmas and need to return home. And we don't want them to get caught out. So they will be dealt with on a compassionate basis, case by case, by WA Police, to do what we can to help them out. But because of the situation in Victoria, the risk there, these returning Western Australians will have to self-quarantine for 14 days when they arrive back home, and they will need to have a day 11 COVID-19 test. We know this will unfortunately cause some inconvenience and unhappiness. We will work with airlines and the airport to manage this situation as best we can. What we also decided this morning is how to deal with the people who have arrived in Western Australia from Victoria in recent days by air and road. Now that the virus is in Victoria, there is the potential that they could have been exposed before they travelled to Western Australia. So that is a risk we need to manage quickly. Effective immediately, anyone who arrived in Western Australia from Victoria on or after the 21st of December, I repeat, since the 21st of December, or was in Victoria on or after the 21st of December and has since arrived here, are required to do the following. They will need to self-quarantine immediately. They will need to be in self-quarantine for 14 days from when they arrived in Western Australia and get a COVID-19 test at any point symptoms develop. They will also need to present to a COVID-19 clinic for a test on day 11 after their arrival. So, for example, if someone arrived here on the 21st of December, they will need to go into self-quarantine until the 4th of January. They will need to have a day 11 test tomorrow, which is 11 days after they arrived in Western Australia. This decision does not affect anyone who arrived here before the 21st of December. Look, the timing is terrible, but COVID-19 doesn't respect dates. It doesn't respect celebrations. What it means is people who are here from Victoria cannot go out tonight on New Year's Eve. It is really unfortunate, but it is necessary that they stay home. We just cannot afford to take the risk. This afternoon, we will be contacting everyone who arrived here from the 21st of December onwards to tell them of what is expected of them. We are able to do this because of the G2G pass application process which has been put in WA. There is going to be a lot of people needing to get a day 11 test in the coming days. So in the coming days, we will be making the necessary arrangements for people to get their day 11 tests. The Health Department is preparing our COVID-19 clinics for a surge of people presenting for tests. We have seen long lines outside COVID-19 clinics on the East Coast in the past week. Those images are becoming very familiar. Even with a surge of health staff and additional operating hours, it is likely we will see queues at our clinics. This is the world we live in right now, and I thank everyone for their patience and for their understanding. I also want to add, if you have recently been in contact with someone from Victoria in WA, you do not need to be tested, but the general rule continues to apply. If you develop any symptoms, get a test. I hope we don't have the same long lines here in WA, but what I do ask is for everyone to be patient and understanding if there is some time to wait for their test. These decisions do not come easily. They are not easy decisions to make. We know every time we make decisions like this, we have a big impact on people. They are restrictions that we would prefer not to put in place, but they are decisions based on the best health advice that we have to make and that we have to take in order to keep Western Australians safe. Our state has been in the enviable position of being free of COVID-19 in the community for almost 9 months now. And that is because of the swift actions that we have taken and the sacrifices that we have made collectively as a community. That is why we've been so successful together in 2020. But we all know this cannot be taken for granted. New, more virulent strains of the COVID-19 virus are emerging. The United States has just had over 200,000 positive cases in a single day again. The United Kingdom is dealing with record numbers of infections and record numbers of deaths. This is an extremely dangerous time for everyone. The outbreaks in New South Wales and Victoria are a direct consequence of what is happening overseas at this very moment. We share the pain of our friends on the East Coast. But at the same time, we will take the necessary measures in the interest of the people of Western Australia to keep our community safe. And that is why we have taken these actions today.